Hello, I'm Dr. Winteregg, and for this week's Tip of the Week, I would like to talk about the different possible associate pay structures. There are many systems that you can go with. There's having a base, there's a percentage of production, percentage of collections, including the lab fee, not including the lab fee, base plus commission, and once you get into this arena, it can become very confusing. And I believe I can safely say that at MGE, we have as many doctor-associate pay structures as we have clients with associates. But I want to try and clear some of the fog here and give you a few key factors if you have an associate or you're thinking about bringing an associate on. So it's important, doctor, for you to understand and know how much production is this associate going to be doing. The number that we have found where it starts to work for both parties is around $40,000 a month. If you're not going to be having $40,000 a month worth of production for this associate, then it's probably better off for you to just do the production yourself. Because at that level below, it just becomes way too expensive. Then you also have to know, going in to finding an associate, what procedures are they going to be doing? If they're going to be doing endo, surgeries, larger crown and bridge, then their production is going to be higher and they're probably going to be compensated a little bit more. If you're not going to be giving them those procedures, that needs to be clear to them when you're discussing whether they're going to come into your practice or not. In some offices, the associate will end up doing prophies. Well, that's going to have to be figured out, and is that okay with your associate prospect? And the key factor here, once you have an idea of their production target, now sit down and look at how much you can afford to pay them based on that production. Oftentimes, it's 25% or less commission. And I know that flies in the face against associates you're getting 30, 35% plus. But then again, you have to look at what procedures are they doing and how much production are they doing in a month. The key factor here is, doctor, you have to do the numbers, sit down with your CPA if you have to, look at the history of production and overhead in your practice to decide what the number is going to be. Then when you sit down with this associate, you're very clear, these are the procedures you're doing and this is the pay. Now there's going to be some fudge factor, some wiggle room, but if you have done the math prior, you're going to know your limitations, and it's sort of like a marriage. You're only looking for one good person out there to fit within these parameters. The next associate may have different parameters that you have to sit down and do this process all over again. So I hope this has been helpful. The key here is do your homework and then just let the associate know exactly what the parameters are, and then just look for the right person. And that's my tip of the week.